Hey folks, this is Gray here, and today we're going to break down a review on JASE Medical. And here's one thing I'm going to tell you folks right up front when it comes to this review, and specifically this video. I implore you to give it an opportunity and listen to the end, because I'm going to break down what you get in this package if you decide to go with JASE Medical. I'm also going to break down emergency room visits. I'm going to break down the cost of antibiotics, and there's going to be a lot of information in this, and this may help some of you folks out there in a time of need, specifically for antibiotics. I know there's a lot of folks out there that use, how do I want to say it, not so traditional resources, but I find this company to be quite intriguing, to say the least. And I'm very happy with what they had sent me and what you get and for the price point. And we'll go over the pricing, and I'm going to break down their pricing and the pricing that it would cost you to go to your physician. A lot of this will be without, let's say, insurance. Some of you folks may have some phenomenal insurance out there that may be different and may be more beneficial to you just to go to your primary care physician or whatever it may be. So first I want to show you, before we get into all the nitty gritty of this, and I've been really trying to figure out how I want to do this review, because I want it to be extremely informative and answer a lot of your questions. And of course, if any questions at all that I do not answer in this review, please don't hesitate to email me at GreyManPrepping@gmail.com. And if you are interested in this product, I will have a link down below to their website. Now, let me be bluntly honest with you folks. If you click on that link and you order through them, it will support the channel. You just want to be upfront. No funny stuff. You know what I mean? They don't have any type of discount code or stuff like that. I think when I broke down the pricing myself, it was very affordable to the way I look at it. Someone who is without insurance. Now, remember one thing, folks. If you look around the world, and I'm going to use Cuba for an example. I know you're saying we're in America, but I understand that. Those folks out there are unable to get medications, specifically antibiotics, and the list goes on. Some people say, well, that could never happen here, Gray. Don't ever say never, folks, specifically in an emergency. Now, let's dive into this. So you're going to, if you go through the whole process and you get their product, it comes in a little pouch like this. You can keep it in this pouch, or you can put it in your med bag or whatever you see fit. We're going to go over the longevity of antibiotics and all that stuff like that. So again, very informative review. Please bear with me, folks, and if you can, please watch it to the end, because this has a lot of information in there. So let me open this up. There's certain things I'm not going to show because it has my name on it, of course, but I want to show you what you get. So in this case, I'm going to pull this one out. You get a Z-Pack. I call it a Z-Pack. You know what I mean? This is azithromycin. I'm trying to make sure it's up there on the screen. And it's probably not going to focus on there. It works right back here, but you get azithromycin. It's like a Z-Pack, right? Everybody's probably familiar with the Z-Packs. And then also in this case, you're going to get 4 other antibiotics, okay? And I'm going to go over the names of each one of these antibiotics here in a minute and some of the things that they can help you with. What I really thought was really interesting and cool, outside of the case that it comes in, is something that's very helpful that they throw in here. This book. It's an emergency antibiotic guide. And it breaks down inside this book all the different things that you need with the medications that they send you, okay? And it breaks down pretty much everything you can think of, what the specific antibiotics might be used for, and stuff like that, And here we are, with the azithromycin, and it gives you expiration and storage, if you're pregnant, breastfeeding, notes, cautions. It gives you all that information, and it's just a very informative little book that comes with it. So you won't just be lost. You just won't be handed a bunch of medication and not know what they're for, and that comes in this little case as well. So I thought that was very nice of them, because sometimes, there's all different types of, antibiotics out there in the market, and they kind of give you the 5 main ones. And this is definitely for a SHTF scenario. I think this is going to work really well for the preparedness community if you give it a chance. A lot of folks, some people already know about this. I've seen one other review in our community in regards to this product. over at, I think it's Iridium 242. And it was cool to see that our community is starting to, folks in the medical community are starting to reach out to us, the preparedness community, and give us options outside of the alternative, if you guys know what I mean, by going the dark web and all that stuff like that. So, excuse me. So I'm kind of using their website to give you the information, so that the information that I'm giving you is 100% correct, basically from their website. So, matter of fact, let me do this. Let me bring up my notes here to make it easier for myself. So who is JASE Medical for? It says JASE Medical is for adults who desire an emergency supply of medication to have on hand in the event of a serious emergency, or when professional medical help is not available. I think that underlines their kind of like their mission statement, what they're trying to do here in the company. Second, our service is available nationwide. We are currently identifying opportunities for service outside of the U.S. for you. So for you folks in Canada, Sweden, and all the other places like that, things can be a little bit more complicated, but it's something that they are working on. It says, if we aren't in your country, please email us. It gives you the email answers at jasemedical.com. You can go to their website and find this information, and we'll put your request at the top of our list for expansion. 3, in accordance with our commitment to safety as leaders in the space of emergency medication, we use only board-certified physicians in our provider network. Some people are going to ask, what about the legality of JASE Medical? You know, are they doing something they're not supposed to do? Which is a good question to ask. But it says the legality, okay? Yes, JASE Medical contracts with board-certified physicians who are licensed to prescribe medicine and treat patients in your state. And complies with all governing medical laws in the U.S. So, some people may get freaked out because they're going to ask you for identification in the process if you go through their consultation is free. So you can have a free consultation with these folks through the website as well. And like I said, I'll have that link down below. Anyways, the reason they ask you for identification, because I had to give mine in order to even get this, just like you would give your identification at the hospital, urgent care, or pretty much anywhere you go. And things like that. But anyways, it says, to comply with telemedicine laws, our physicians are required to verify their patient's identity with a government-issued photo ID. We ask for a photo of your unexpired government-issued ID, such as a driver's license or a passport. So you have to have some sort of identification to prove who you are. And that just makes sense when it comes to medicines. 6, our physicians are not meant to replace your primary care provider. In order to safely prescribe medication, we require that you have been seen by a healthcare provider for a general exam within the past 2 years. Basically, if you've gotten a physical, or if you've gotten some test work done, or if you've just been hospitalized for any reason, you know, they're looking to see to make sure that you've had at least some sort of checkup, and because they want to make sure that you don't have any allergies or adverse reactions to some of these antibiotics. So I think it was very smart of them to do so and to kind of ask that question. And a lot of people are going to ask, well, Gray, what about if I get these antibiotics? How long are they going to last? How long will these antibiotics last me, Gray? So I have an answer for you, and they also put this answer on their website as well. And the question is how long can antibiotics be stored for? Most antibiotics will come with an expiration date between 2 and 3 years from the date of manufacture. To maximize shelf life of your medication, they should be stored in airtight containers and in cool, dry environments, which most of us in the preparedness community understand this process with most of the stuff that we store. Under proper storage conditions, antibiotics expiration dates can be extended from a minimum of an additional 5 years. So that's an additional 5 years on top of your 2 or 3. Now, they went and did studies on antibiotics, and you can find this anywhere online if you can dig into it. But it says studies have shown that 90% of antibiotics have retained potency after as many as 20 years. So as 20 years later, antibiotics, from the studies that they've went through and dug into on their research, 20 years later retain 90% of its potency. To me, that's awesome. Long-term storage, folks. Long-term storage. All right. So I want to double check here. And people ask, is it legal to prescribe this type of medication or a pack of antibiotics and stuff like that? Is it legal to do so? Yes. Prescribing antibiotics or other medications to have on hand for future use in an event of travel or emergency is a common practice among providers. Some of you guys may have great general practitioners or primary care physicians that look out for you, and you ask them, hey, can I get a little extra just in case things get tough? What happens if there's a natural disaster and all the pharmacies are closed? So what about if there's a grid down situation and you can't get to the pharmacy? There's all different kinds of scenarios that I really want you to think about. Think where you might not be able to have normal access to a physician, to a pharmacy, and so on and so forth. So it's very pertinent that you have some sort of antibiotics because they're pertinent to survival, folks. Like I've said, from the smallest cut on your foot, finger, or whatever, these things can lead to very serious things and life-threatening issues. And this is coming from a medic, all right? Combat medic, U.S. Army. I'm just being honest with you folks. The smallest thing can go very bad for you long term if it's not taken care of. Wound care procedures and then the antibiotics to follow up. So having stuff like this on hand, to me, in the preparedness community is huge. So people are going to ask, well, what medications do I get in this 5-pack? And then we'll get into pricing as well. So what comes in this little bag here, like I showed you before, you're going to get amoxicillin. You should be very familiar with amoxicillin. And I'm going to go over some of the things that some of these medications will treat as well, just to be thorough. But one of them is amoxicillin. The other one is azithromycin, like I said, the Z-Pack. The other one's going to be Cipro. I like to call it Cipro, but ciprofloxacin. And don't you know how Gray is with words sometimes, so don't be upset with me if I don't pronounce it absolutely correctly, all right? The next one is doxycycline, and the fifth one is metronidazole. And like I said, I'm not the best at when it comes to these words. I'm not perfect, right? But just to kind of give you an idea, and what you get in there, and it's on their website as well. So a lot of folks are going to ask, well, what conditions are treated by these antibiotics? So I kind of want to give you a rundown of some of the things that it treats. But it also comes with that little book in there that kind of gives you a lot more detailed information. And basically, antibiotics are usually taken for specific types of infection and should be specifically prescribed for those types of infections. So know what you're taking and what you're taking it for. They all have their different, like I said, let's say, azithromycin is different than amoxicillin, and they're used for different purposes, and the list goes on, right? Anyways. So some of this stuff that what you get in this pack here, this is what it's going to cover, and this is just as like a broad kind of thing here. But I made a list: bioterror from anthrax, plague, tilmaria, bite wounds, cellulitis, intra-abdominal infections, tooth infections. Imagine having that bad toothache, man, and having the antibiotics to relieve that that abscess or whatnot. Ear infections, pneumonia, sinusitis, strep throat, urinary tract infections, traveler's diarrhea, cholera, where else do I got in here? Salmonella, Lyme disease, malaria, Q fever, Rocky Mountain spotted fever, chlamydia, bacterial vaginosis, pelvic inflammatory disease. Just to name a few, folks. Just to name a few. And so some people can ask, well, great, can I order this once a month? Can I get these all the time? Unfortunately not. It doesn't work in that manner because you can't overprescribe things and so on and so forth. So let me break it down, right? They take their antimicrobial stewardship very, very seriously. And their policy is 1 emergency antibiotic kit per person per year. So you have a family of 5. So each of you can order one of these per person in your home. So that would be 5. You would each have your own pack of antibiotics and the 5 that I named. So if you have 5 people in your house, you can get 5 packs, but it's 1 per person per year. Now, after that year is up, you can follow up with another year. Let's say you didn't use a couple of them. Let's say you got into emergency and used 1 or 2 of them, but you didn't use this or that. Well, at the following year, you can order another. And then you can start stocking these and, back stocking, whatever you have, and keep them in rotation, of course. But every year, you can order another cycle or a 5-pack of these medications. Now, let's dive into some of the other things that you're probably going to have questions in regards to. So what I wanted to do, and I did some research before I did this whole thing because I wanted to be extremely thorough. So first, most people get sick, and where do they go? The first person, we're going to dive into both. It's either an ER visit or an urgent care visit. So let's check this out, right? Where do I got it? So let me bring up here a little clip, or a little slide here of the average ER visit. Okay, the average cost of an ER visit and how it plays out to you. As you can see on the screen, this is the average cost of a common conditions treated. These are ER, emergency room visit at your normal basic hospitals. Acute bronchitis is $814. Sore throat, $620. Low back pain, $751. Attention to addressing removal of sutures, which is the cheapest one, at $343. Remember that number, $343. That's one of the cheapest. And then some of the common services: stitches, $500, x-rays, $260 to $460, chest pain, $1,000, broken bones, including surgery, up to $10,000. That's insane, folks. Just think about those numbers, and these numbers are without insurance. I want to reiterate that this is without insurance, okay? Now, I have another slide. I want you to think, people say, well, certain states differ in the way medical things run, right? So I'm going to throw up another slide here, and it kind of breaks down per state on the average ER cost. So let me throw it up on the screen for you to see. And this covers pretty much every state on here that I can think of. But let me see. So if I look at this here, it says Florida, the average ER cost is $3,102. $3,102. What about if you're on Medicare, Medicaid, or if you're on some sort of share cost or something like that, or you don't have insurance? You may also have you have to meet a deductible, and all this other stuff like that. Now, like I said, this is not the end-all, cure-all kind of situation, but I just want to use some of these statistics depending on where you're at. I think one of the cheapest places, let me see on this thing here, looks like Maryland might have the average ER cost down to $623. But let's say you're out, and I'm trying to think of somewhere. Where is somewhere rural? I'm thinking rural. Alaska, the average ER cost is $2,070. And then we have, I was looking for Arkansas, that kind of, area in the rural areas, and it says about $1,300. So people are going to say, well, Grey, what about urgent care? Urgent care is a more affordable option for a lot of folks. And here's a big thing when it comes to ER visits and urgent care. Some folks don't like to go to these things because of the current health crisis that we are dealing with. Even if some people say, well, it's tapering off, but there's still a lot of sick people in hospitals. Some people don't want to go to a hospital because they don't want to be exposed to what is going on in that hospital. Plus, a lot of hospitals are overcrowded. The wait times, the sitting in there, dealing with all these other sick people around you is where I think something like this can come into play, specifically if you just need some antibiotics for a specific thing in your home. You cut yourself at home, you're not feeling good, you need a Z-Pack, you got it. You don't have to go and get it. And it's funny how other countries work. Some other countries you can go just up to a pharmacy and buy these things with no big deal. But here in the U.S., it's a money thing. Anyways, let's dive into urgent care costs, right? Where do I got that one? And then we're going to also look, and we're going to wrap this up and pull it into a whole thing of roundabout the most affordable to the most expensive. So I'm going to throw this up here for you, folks. And a lot of you guys have these urgent care centers in probably strip malls and other places. And again, there's a lot of sick people in there. Anyways, so it says here, each urgent care center has a different office visit cost. The office visit cost of the baseline fee patients have to pay. The office visit cost typically between $100 to $200, but it may be more expensive to include some basic tests and procedures. According to our research, their research, this is a website I'm using, the average baseline office visit cost of an urgent care is $141.60 minimum. That's the absolute bottom line, $141.60. And this is without prescriptions. This is without anything. This is just going there, getting diagnosed, and then prescribing something, and then, of course, you have to go fill that prescription. Now, again, I wanted to show you another slide in regards to urgent care, in regards to just a few cities, just to kind of name a few, some of the major cities. So I'm going to throw this up here. Average out-of-pocket urgent care costs in major cities. New York, $189. LA, $175. Chicago, $166. Philadelphia, $178. And the list goes on. I think who's the cheapest on this list here? Looks like Las Vegas is at $135 for a major city for an urgent care visit. So just to kind of give you guys an idea. Now, now we're going to get, so people are going to ask me, okay, Grey, what is this going to cost me? What is this going to cost me, Grey, to have these 5 antibiotics? Now, when I show you this, I want you to let me finish after I show you the cost of this. And then I want to show you a thing that I put together to show you how the cost breaks down, okay? I'm trying to be very, very thorough so I have as much as information for you, the preparedness community, so that you can make an informed decision with a lot of information at hand. And that's why this review is a little bit long, but I feel it needs that attention and for you to understand the cost effectiveness of what you get in this bag. So let me throw up the slide. This is directly from their website, okay? And as you can see here, the cost for this is $259.95. And people are like, Grey, that is expensive, Grey. $259, Grey. Wow. So I'm going to break this down. And of course, right here it tells you what you get for that $259. You get unlimited physician follow-ups for any questions relating to the use of the medication. So you can call them up and be like, hey, I lost my little book. I'm not feeling this. This happened to me. Which one of these should I take? Second, emergency. You have the emergency antibiotic guide that's in here, and then you get all the medication with that as well. And like I said, this is for one adult. So people are gonna like, great, $259. Now let's really look at the cost. Is it that expensive? Do you feel that it's that expensive? Let's find out. Let me bring up my main slide here to kind of show you. So this is the common cost of antibiotics without insurance. Some folks are like, well, Grey, I have insurance. Well, that's awesome. Go to the hospital, do your thing, pay your out-of-pocket cost or whatever you got to do. Fine. There's a lot of folks out there that don't have that option. If you're covered under certain medication, the insurance thing is like a huge scam at some point. And I'll be 100% honest with you. I haven't had medical insurance in probably, I don't know, 10 years. You know, they try to give me some free stuff, you know, when all the other stuff, but I don't want to get into that. I don't want to take away from this video. Anyways, so the ones that are highlighted here in yellow are the ones that you get in this packet, the packet here that I've shown you. The ones that are marked off red, you don't. So I felt I didn't need to address those. So the amoxicillin and the azithromycin and all stuff like that, that's the generic price on one side, and then you have the brand price on the other side. So minimum at generic price is $125, and this is without the ER visit, okay? This is without the ER visit. This is just the cost of the medication. Now, the brand price is $680. Okay, now this can fluctuate depending on where you live as well. If you're living in California, if you're living in Florida, if you're living in rural Alaska, these costs can differ the way medications work, and then the availability of these medications when you need them. So down below I have that. It says per ER visit, the minimum it's going to cost you for one. Let's say you're getting 5 bottles of medication here, folks. 5 bottles. 5. So that would equal 5 visits. So minimum ER visit is $625. That's with the ER visit, and that's with the medication. One medication. Let's say you're going there for a Z-Pack. Let's say you're going there for amoxicillin. Whatever it may be, this will be the minimum at the ER, $625. Now, on the high end, you're looking at thousands and thousands of dollars for one visit, one medication. Now let's look at the urgent care. Minimum to get out of urgent care with medication, you're going to be looking at $270. Now, someone should say, well, Grey, aren't you adding this and this and that? Yeah, so what I'm trying to say is minimum with one of these medications, and then you go each follow-up visit, you're going to pay several $100s per visit, plus the medication, the cost of medication. And again, I'm going to refer back to, if your insurance may differ, you might have a different out-of-pocket, but what do you pay insurance a month for? I know a lot of people, when Lady Grey looked at her insurance policy, just to cover her and my daughter, was almost $260 a month. A month. $260 a month. I told her, don't put me on it, because it would go up to $300 and some a month. So you can run your own numbers and do your own research from the experience that you have, but these are some of the numbers that I've ran. And I'm thinking, okay, so I'm going to go to the doctor. I'm not feeling good. I have chest congestion. They're gonna give me for a cold or whatever, some sort of infection. they're going to give me a Z-Pack. So a Z-Pack's going to cost me $31.30 on the generic side of things, and then my visit is going to be about $500 minimum. If they decide to run some other tests, chest X-rays, and all the other stuff like that, then I'm probably up to $1,200 to $1,500 or more. So now I'm going to be, to get my chest taken care of and get my cold or whatever the medication, the Z-Pack that I need, I'm looking at anywhere from $500-$600 to several $1,000s for this visit. Let's say I go to urgent care, $145. Let's say it costs me to get there. They prescribe me the medication, and then I go and get the Z-Pack, and then I'm at almost $200, somewhere between $175 to $200 for that visit and to get that medication. And people are like, well, great, that's cheaper than $259. But yeah, I have 5 medications, not one, and I only have one visit. If you want to call it a visit, a telemedicine, I have one thing where I fill out a form and they sent me 5 medications for $259 and change. Okay? So do you see how cost effective this can be, folks? I don't know. To me, this is a game changer for me personally. I think this is a phenomenal product. I'm so glad that Jace had reached out to me, because I was ecstatic to when because I was very skeptical at first, as being who I am, and trying to understand what they were offering. And then once I did the research and saw the medications that they gave me and how simple it was, 10, 15 minutes, and I was done. I didn't have to go to a doctor. I didn't have to leave my house. I just did it on the computer, did this and that, boom, I was done. I got a tracking information, and boom, it was at my door several days later. So I thought it was very phenomenal, very quick and efficient process. Anyways, folks, this is my review of the JASE Medical antibiotic supply kit. And I think it's very awesome for the preparedness community. Now, maybe some of you folks think differently. So what I ask of you is, please drop some things down in the comments, questions you may have. I may be able to answer them. If you're interested in this product, again, the link is down below. And to be totally transparent, if you click on that link, it does support the channel. I think there's like a 3 or 4 or 5% percentage or something like that they give me for anybody who orders this type of medication through them. I'd rather be upfront with you folks. So it is what it is. And if you don't have to use my link if you don't want to, just go straight to their website. It's not about making money for me, folks. It's about showing a product that, to me, can save your life. To be honest with you, it's all about you, the community, and life-saving things that you can purchase without going through the hospital, 5 different times, without going to urgent care 5 different times, and having these things on hand at your disposal in your, let's say, your prepper medical pantry, having them ready to go. And if there's 5 of you, and let's say 5 of you have done this, and you have the finances to do so, and you got one from everybody in your family, be it 1 person or 5 people or however many people you have in your home, I think that having this readily available without having to go anywhere. Hey, little Joey or little Miss Ann, needs amoxicillin because they have this type of infection. Hey, can you go to the cabinet and grab that without having to take take your child or take yourself or whatever to the hospital or urgent care, pay whatever fees that they're going to ask you to pay, go through that whole process, then go to the pharmacy and that whole process, wait for it, and then come home and then have it. Okay? But let me know what you think down in the comments. I really like to hear from you, the viewers, and what you guys think of this product. Really want to hear from you. Other than that, this wraps up this review. I do apologize that it went long, but I wanted to be very, very thorough. I wanted to be as informative as I possibly can. So truly appreciate every single one of you that watches. If you can, please give it a thumbs up. And share this out with other folks in the community. If you think anyone that you know, family, friends, whoever it may be, share this out. Let folks know there's an option now for us and the preparedness community. So thank you, JASE Medical, for this opportunity to present this material to my viewers. That's about it, folks. This is Grey. And like I said, looking forward to seeing everybody tomorrow night at 7 p.m. Eastern Standard Time live with Dr. Arthur T. Bradley, the EMP CME expert, New York's bestseller author. It's going to be fun. 7 p.m. Eastern Standard Time tomorrow night. This is GreyMan. I'm out. I'll see you guys on a rebound. God bless.